Hi, my name's Mark Richards. Some of you might recognise me from my YouTube vids or from the hair and dental group that I run on Facebook. I had my hair transplant, the second one, with Dr. Cinik just under 5 weeks ago now, and it's already started growing well. Don't seem to have had much shedding, so hopefully it's just going to keep growing. On the first day you'll get taken for your EKG, which sometimes is known as an ECG, and they basically just measure your heartbeat, and they put little sensors over your chest, your stomach, your wrists and your ankles. They also do your blood test. So they do these little tests, then after that you get taken back to your hotel where you can relax. I'm going to speak about day 2. Get picked up from the hotel fairly early. When you arrive at the clinic, they'll check some of your paperwork over first. So your blood test results and your EKG results, they analyse them to make sure you're suitable for the operation. After this, you go for what's called the hair analysis. It's like a microscope and it shows your scalp and determines the quality of your grafts. So it basically they scan over your head and it comes up on their computer screen, and they can take photos from this to analyse your scalp. So it shows you how good your hair quality is. It looks really close up and it's very good. You then go on to your consultation, which is with Dr. Cinik himself. So when you go there, make sure you take a photo of yourself before you started balding, so how you looked before you were bald. It's important to do this because it gives them an idea then of what you used to look like, how your hairline looked, the direction of your hair. Once this is all done, and Dr. Cinik draws it on, and you can discuss with him how you'd like your hairline. But probably the best thing is to try and get it more like what your hair used to be like. So for example, this time around I was happy with my hairline from the first operation, so we concentrated more on the crown this time. After the consultation you will have photos done, so you have before photos and after photos, and they follow your hair story phase by phase. So this, you then go through to shaving. So they shave your hair. Not everyone likes their hair shaved, but a lot of people actually find that they don't mind it once they've had it done, and they actually think it looks quite good. So then you go into the operation, which for most people is probably the most nerve-wracking part, but there's no need to be nervous. They recontrol your heartbeat and look at your documents. They put your photos up, your before photos, so the people operating on you can see exactly how you look with before your hair was shaved. They give you a sedative in case it's necessary. You lie down basically on a bed. It's like a massage table. The anaesthesia, this is what a lot of people find nerve-wracking, but I personally didn't find it that bad at all. It's like a little pinch to your head. It doesn't hurt. To me it just feels like a little flick like that. It doesn't hurt. Then they put the needle in to anaesthetise your scalp. Once you've had it, they'll then say to you, can you feel anything? If you can, you just tell them, and they'll just put another one in to make it completely numb. So when you're having the operation, you're just sat there relaxing, and you're fully aware of the situation, what's going on. They have a TV on, so you can watch what's on the TV. They do everything for you, so there's nothing to worry about. Then you have your lunch break. So it's prepared, all done by the clinic. They do this, it balances your blood sugar. It's really nice lunch I had. So the next thing they do is your channel opening. I had Sapphire FUE. So they basically cut the little slits that they're going to put the grafts into using a tool. For mine it was the Sapphire tool. This time I had the Sapphire, and I do think that I healed a lot more quickly with the Sapphire blade. So after the operation you get the translators. They take you to a room downstairs. To me it felt like a spa. I really enjoyed that. They explain how to take care of your freshly transplanted hair overnight. They give you the pills and medications that you might need overnight. So they give you like sleeping pills. It's up to you if you take the sleeping pills, but they give you antibiotics, so it's important to take those. I kind of enjoyed the whole experience. I really enjoyed it. I love the new clinic. It is like a spa. Like reminds me of a cruise ship spa downstairs, and it was really nice. Second day, they basically control your hair transplanted areas. So they check you out, make sure it's all gone well and everything's expected. They also take off your bandages that have been on the sides and the back of your hair. So when you first get in there, they put foam on top of your head, which they give you foam to take home with you as well. It just sits on the top and it softens the whole area because there might be crusts like scabs starting to form, or just dry blood, that sort of thing. This stays on for about 20 to 30 minutes. When you're waiting for the foam to soak in, they then go through everything you need to know about your hair transplant. Post-operational steps, how to apply your shampoos, what to avoid, for example exercise, you can't do exercise for a while, your first hair wash. They then wash your hair using antibacterial shampoo, which they'll also give you to take home for when you're washing it yourself at home. And they clean the whole area, the transplanted area, the donor areas, and it prevents blockage of the cells, and they get rid of dry blood and that sort of thing. After this, in my package, I had the laser therapy, which you sit in this room, dark room, for 15 minutes with like a laser that's lots of red lights that are on the side and the back, and you wear these sunglasses, and it helps the healing process. After that, the doctor gives you one last check, make sure that everything looks fine, and then you're basically free to go home. So what they'll do is they send you a VIP minivan. This takes you back to the hotel, collect your things, check out, and then they send you off to the airport with another minivan.